This case is missing a number 36 tooth. The bone height is relatively sufficient and the overall condition is good. It is a simple and easy surgery case. Rather than using the flapless technique, we can save the attached gingival by making a small flap. So I'll start with a simple incision on the middle crest. This is very similar to the flapless procedure. Also easy to check the bone width. Now I'll use the guide drill. Using the length drill, I'll check the center of the point and start drilling. This is the 2.0 millimeter twist drill. I'm planning to enter 10 millimeters. Let's check the path by inserting the parallel pins. Would you close your mouth just a little bit? Now open your mouth wide. The pins are tilted lingually a bit. Now I will use the pilot drill. You are seeing both the 2.0 and 3.0 pilot drill. This is the 3.0 twist drill. I will use it. Shall we try the drill extension? I will use the wide pilot drill, using the 3.0, 3.8 wide pilot drill. This is the 3.8 twist drill. The last drill is the 4.3 millimeter drill. We are not going to put this drill in too deep. There's no need. End of drilling. We are going to use the 4.8 10 millimeter wide platform. The bone is quite weak, so loosen the torque. It has been firmly fixed to the bone. We will remove the fixture mount. We have attached the cover screw without excision, so there is no loss of attached gingival and neither any need for suturing. This is the X-ray taken after surgery. 4.8 10 millimeter SS2 wide platform was installed in number 36 space. This was a relatively simple case, so we approached with the flapless technique. The length and direction are both okay, but the position has actually been moved forward. From this case, we can realize that although it is a single implant, it is hard to reach perfection. Even though it is a single implant case, for perfect surgery, a stent would be helpful. This is an image of the post-op 6-week X-ray showing good osseointegration and healthy gingival. First, measure the inter-arc distance and select an abutment with appropriate height. An excellent solid abutment was used for this case. This is a wide platform, 4 mm excellent solid abutment. Wide platform types are attached with a 1.2 hex driver with a force of 30 newtons applied. The excellent solid abutment has been connected. The clearance is sufficient for prosthesis setting. Check the exactness of the connection with a standard X-ray. Fill the hole on top with caviton. Prepare an excellent solid impression cap and a positioning cylinder for impression taking. You can see the impression cap on the left and the positioning cylinder on the right. Attach the impression cap and positioning cylinder prior to impression taking. A pickup impression was taken with the polysiloxane type regular body. The impression cap and positioning cylinder have been picked up. The bike can easily be registered using Blue Moose. Once impression taking is completed, connect the protective cap and make sure that the protective cap does not come in contact with the opposite tooth. Insert the lab analog replicating the excellent solid abutment into the positioning cylinder that has been picked up. Create an artificial gingiva and trim it. Pour dental plaster to fabricate a working model. This is the lab analog replicating excellent solid abutment. Select a plastic coping for crown fabrication. This red plastic coping for single implants has an anti-rotation function. Cut to an appropriate length. Start the coping fabrication with wax-up procedures on the coping. The wax-up has been completed and casting done. Trim the overhanging margin with a reamer. The coping now has an exact fit. At this point, we will start with the porcelain work. Apply the opaque. We will perform porcelain buildup. This is a complete final crown. We recalled the patient to remove the protective cap and set a temporary.
크라운을 템포라리로 세팅하겠습니다.
These are the final clinical photos. You can see that the overall outcomes are highly aesthetic.
볼 수가 있습니다.
This is the final panoramic X-ray image. You can see on the standard X-ray that the margin fit is good.